We almost passed a single-payer bill. By 2 Senate votes we lost in 2001. What's changed since then? One of the biggest changes is unions don't bargain for wages and working conditions anymore. It's all about health care, and we're losing. So there's a real incentive for labor to be for single payer, and that's happening nationally. So we have a lot of power right here. And we have to defend the Maine Equal Justice Project defends a big vulnerable population, poor people, disabled. And that system, Medicaid, is under attack by this so-called reform. So we have to defend Medicaid in Maine as well as moving forward.
And if I may, I'll try to be brief. I give the AFL-CIO a lot of credit for getting it. You know, my frustration with the system, looking at it all these years and looking at politics at the State House, is that my somewhat cynical view is the reason we have the dysfunctional system we have is, what Dr. Reitman, I think, who used to be the editor of the New England Journal of Medicine, a Harvard doc, calls the healthcare industrial complex, parroting Eisenhower on the military industrial complex. But it's a convergence of the healthcare industrial for-profit sector with the political astuteness that if you give enough people somewhat decent coverage, you vest them in the system because they're easy to scare that any change they might lose their privileged position. And I keep railing about the fact that in reality, I have no problem with socialized medicine. I'm all for it. I have an issue with selective socialism, which is what we have. We have a 60% taxpayer funded system when you look at Medicare for seniors, Maine Care for the low income, S-CHIP, for middle income kids, military health care, Indians, teachers, state employees, it's a 60% taxpayer-funded system. And I keep pointing out that the uninsured and underinsured part of our tax dollar goes to provide a benefit we and our families need but can't afford to someone else, which is like paying for public education, but your kid can't go. And I don't know when that became acceptable, except that I think that that it is the job of all those who advocate for those who do have decent benefits to educate the folks they work with about the reality, because you cannot put yourself on an island and think that you're, and again, I give the AFL-CIO big credit, they get it. You may have a privileged position at some point, but if the whole system's dysfunctional, it's going to bite you sooner or later. So we all need to come together and demand a rational, humane, equitable system for everybody.
Any other questions?
One quick one. Why, there's not a specific, the legislature's not in session, there's not a specific bill that you all are advocating for. Why this push today, right now?
Well, as to the timing of this, we were invited to testify before this committee of the legislature, and they have a calendar. That's why we're here today. This is the beginning of an effort, not the end of an effort. We believe that public education is a very important element of this fight. Legislatures and politicians are constrained by what public attitudes and opinions will allow them to do. We hope to change that tone through information to educate people. Why aren't the doctors here? Why isn't the medical society part of this? The nurses are. A poll was done by the Maine Medical Society a year or so ago that showed that over half of Maine doctors would prefer a single payer system to what they have now. But the Medical Society has a problem. Some of their members are very well paid physicians. Some of their members are physicians who are probably not paid enough. Primary care specialties, for example. That's why many people aren't going into primary care. It's difficult for them to take an organizational position on this without splitting their own professional society down the middle. But I believe that most doctors and a growing number of doctors are going to come over to our way of thinking, because I know of nowhere else in the world where the degree of interference in medical practice, decisions by doctors, are interfered with more than the United States. We hear a lot of talk about the government controlling your health care. Well, that's not a problem. Medicare is not the problem. It's the private insurance companies that are trying to micromanage medical care in the name of saving money. And they will never change unless you change who they are. It's not that they're doing what they're not supposed to be doing. It's that they're doing a very good job of what they are supposed to be doing. And that is generating return for their shareholders. So that's a structural problem that has to be addressed. And I think most Maine physicians would welcome a system that allows us to do what we think is best for our patients without having economically based demands placed upon us.
Thank you all for coming. I think we'll wrap this up. And thanks again to Dr. Shao for joining us today.